Hello, I am Dr. Brian Nell with Cypress Pilly Healing Arts, and I wanted to talk a little bit about tinnitus. Now, tinnitus is the ringing in the ears. This can be a high-pitched ringing. It can be sounding almost like cicada or the sound of train tracks, like the wheels going over the train tracks and that high-pitched noise they make. It can be low. It can sound like a constant whirring of machinery. It can be constant in its tone, or it can even warble. It can go up and down and change frequency. The reason for tinnitus can be due to trauma. It can be trauma to the ear, can be trauma to the head. It can be a result of medication. In Chinese medicine, it can be the result of liver yang rising, which is a nice way of saying that when you get angry, the blood is rushing to the head. When you're frustrated, you're having this kind of constant sound, or it can be due to kidney deficiency, which means that you're kind of running out of some qi in the body, and it needs to be replaced. So we can do some things in order to help alleviate, or even in some cases eliminate, the ringing. Now, if it is ringing that is a result of trauma, the best thing you can do is some exercises that we're going to play with here this evening, and the sooner you start them, the more effective they can be. Now, that does not mean that if you have had it for a while that all hope is lost. It just takes a little bit longer through these little sets of exercises to get it to end. If it is from a medication, I recommend speaking with your primary health care provider and seeing if there's anything you can do to help eliminate that. And of course, if it's liver yang rising or kidney qi deficiency, you come see an acupuncturist. And there's things that we can do on top of these little exercises to help mitigate that ringing. Now, for these little exercises, there's a set of 5 little exercises that we can do. We will do them to both ears simultaneously. And of course, as you go through, go easy on the ear. This doesn't have to be vigorous. It doesn't have to be uncomfortable. The idea here is to do these little exercises whenever is convenient, maybe sitting at a red light, maybe waiting for your water to boil if you're making coffee or tea. But to try and fit this in a couple times, 3 times a day, can really help. So for the first of these 5 moves, what we want to do is simply take the pads of the thumbs, put them on the mastoid process, which is this little protuberance of bone just behind the ear, and we're going to just massage in a nice circle. We want to go into the hollow that's just below the ear and make that nice round motion. And we can do this several times, as many times actually as you feel comfortable doing. You make a nice little massage. Beautiful. Then the next move, what we want to do is take the palms of the hands. We're going to put them over the ears, and our goal here is to make a little pop. Be careful with this one. We're not trying to make a big pop, but we just lightly squeeze the ear and then release so that we get this nice little pop of the eardrum. And of course, this you do as many times as you're comfortable doing it. Then the next one, you want to take your index finger, set it on top of the middle finger, and you're going to use this to make a little percussion. This one is named Beating the Heavenly Drum, even has a fancy fun name to it. And what you'll do is cover the ears, not hard, but just cover them. You're going to cross the fingers and you're going to strike along the back of the neck, right where the base of the skull is. So, boom, boom, boom. And it should almost sound like somebody is beating a drum in the ears. Now, I had talked a little bit about liver yang rising. In Chinese medicine, there are paired organs, the liver and gallbladder. You'll actually be tapping, when you do this, gallbladder 20, which is a very important point and paired channel with the liver channel, so this can help lower that liver yang rising. To continue with this same idea, the gallbladder channel zigzags back and forth over the head, over the ear. And what we want to do is make our hands into a loose little cupping action, put that over the ear, and you want to imagine that you're tuning in a dial. And you're just going to lightly massage that side of the head, massaging those channels. And of course, doing it at the same time. And then the last one is to massage the ear. So I like to start at the top and massage the ears down to the lobes and then back up to the top. But you can choose any pattern you like. The goal here is just to massage the ears, just to work on the external parts, and of course, just taking our time with it. And those are the 5 moves. So again, number 1, massage around the mastoid bone. Number 2, a light little pop to the ears. Number 3, beating the heavenly drum. So just bloop, bloop, bloop on the back of the neck, the base of the skull. Massaging the gallbladder channel. And to finish up, massage the external ears. So hopefully you find this little pattern something that you can work in. And again, doesn't have to be long, doesn't have to be hours on end. Couple minutes every day can make a big difference on how our ears feel. So take this, play with it, have fun with it, and enjoy.